So my name is Jake Fetter, and I'm from Los Angeles, California. I met Dr. Rincon because I had an accident while I was playing with my son. I sort of twisted and threw him, and after that maneuver I felt immediate pain shooting down my leg and was in debilitating pain right away. It was absolutely crippling, debilitating pain. The type of pain I never, ever felt before in my life. So at that point, many people recommended Dr. Rincon and his service. So I made an appointment, came in for an initial consultation, and I had many images already with me, so we were able to be quite productive in that first consultation. And Dr. Rincon was able to diagnose my situation right away.
So the first time I met Jacob at the office, I saw the MRI, diagnosed this herniated disc in the L5S1 towards the left side, compressing on the nerve root. But the important thing is it's a very tiny thing that can make life miserable, you know. But the specific is, the area that was compressing on the nerve, that's the most sensitive part of the nerve. That's why you were in this excruciating pain. So what I proposed, we always try to manage this as conservative as possible. Medication, physiotherapy, some other therapies we manage, but in some cases when we know that surgical procedure can actually provide more relief or more benefit, like in this case endoscopic spine surgery provides, I think it's it's a blessing we have that in our armamentum, so we can offer that to the patient. So that's what we did. The endoscopic discectomy is going with a small camera, about 8mm incision, so we can decompress towards that scope with the special tools to remove that fragment and decompress completely the nerve root. And after that is the healing process. And Jacob can actually tell us a little more about that recovery process.
Well, the recovery process went just the way Dr. Rincon described. Right after the procedure, the acute pain was no longer there, no longer a factor. And it did take some time to train my body to work normally again, because everything was still quite locked up and frozen, as if the injury and the pressure was still on the nerve. And it took some time to ease my body into understanding that I could trust my leg again, put weight on my leg again. And I'm finally got feeling back in my toes and my leg again. And thankfully made a very fast recovery. My wife is very happy that my scar is minimal, so that's nice. I can't see it, so I wasn't as concerned, but she's happy about that. And I just feel very blessed that Dr. Rincon is here and for giving me my life back. I really am very thankful.
I appreciate your honesty and your words about that, Jacob. One of our goals is we're working on a medical tourism program, but also we want the patients, the local patients and expats who live here in Cabo and surroundings, they know about our care and that they can trust in us, They can trust in the care we provide. So because this is a very important thing to consider, what made you make the decision of getting the surgery here or the care here in Cabo and not going back to LA, for example?
Well, I don't know if you recall, but my father is an orthopedic surgeon, and thankfully he was by my side every step of the way when this happened. I feel very fortunate for that. But right away, I sent my images to 3 or 4 neurosurgeons that we know are family members, and unfortunately, they all had many different opinions. The reason why we chose to come with and have the procedure done here is because you're a master at the endoscope. And that is the least invasive way to get the job done. You don't have to disassemble bits of the spine that you normally would have to do, because you're able to use the natural opening and the canals to get to where you need to go. And the fact that you took the time to master the endoscope is very unique. There's not a lot of neurosurgeons in the world that really master the endoscope. So that was a major factor for me. Also, you live a lifestyle that's conducive to high performance. You eat healthy, you play paddleball, you exercise, you have the training, you're young, you're focused. All of those things were a major factor. The other surgeons did recommend larger procedures, and we chose to go with the least invasive procedure that was on the table, which is the one that you were offering. And that proved to be what it took to do the job and solve the problem. Another factor in my decision is I'm from Los Angeles, and the hospitals there are quite dense. And when you have that kind of density, I was concerned about, the increased risk of infection and things of that nature. The hospital experience here was sensational. My room had a beautiful view. The food was delicious. They took such good care of me. I wouldn't have mind staying a few more nights, to tell you the truth. It was quite lovely. And the level of care was outstanding. And the amount of time and attention you gave to my case is remarkable and very much appreciative. I'm thankful for the service.
Thank you, Jacob, for your words and the trust. At the end, the most valuable thing we have is our health. Wealth is, money. Of course, it is important, but at the end, health is the most important thing that we own. So I really appreciate that you trust in us and on my hands for performing this surgery on you, and that you are here with us, sharing your experience to other patients that probably they think, spine surgery, just listening the word or the words spine surgery is like, oh, I'm going to get paralyzed. There's still like a myth about spine surgery, getting through that, and we are trying to break that myth down. So thank you for that.
Understood. Well, I understand what you're saying. I was quite fearful of having spine surgery. It was a very scary thought, but the amount of pain I was in, it clearly, and based on your consultation, it was clearly the right move for me. And I just can't thank you enough. You don't realize how much value and how much you need somebody like yourself until you're in my position and felt the pain I was in. I'm just so thankful for the service. I'm so thankful for you. You should be wearing a cape like a superhero, like Superman. You gave me my life back. I'm walking again. I'm enjoying my life again, and I appreciate you.
No, thank you.
Of course.
Thank you, my friend.
Thank you, doctor. Appreciate you, man.
I'll give you a hit. Thank you.
I do appreciate it. My pleasure.
Thank you.